Hello, my name is Holly Hope and I want you to do something for me. I want you to imagine you have rheumatoid arthritis. The joints in your fingers are sore, stiff and swollen. You visit your rheumatologist and she prescribes you methotrexate. This is a disease-modifying drug and it's the first treatment you would receive as a patient. It's medically recommended and it's relatively cheap. But your rheumatologist doesn't know if it will work for you, if you'll have side effects, or even if you'll take this drug. So you go home, count out 4 pills, and fetch a glass of water. Now I want you to ask yourself the question, am I going to take this drug? That's adherence, the extent to which you follow medical advice to take a prescribed drug. And the consequences for patients if they do not adhere to methotrexate can be big. We know from previous research that patients who do not adhere to methotrexate, their rheumatoid arthritis progresses faster. And they may be prescribed a biologic. This is another kind of disease-modifying drug, and it may work, but it costs around £10,000 a year to prescribe. Therefore, if we can improve adherence to methotrexate early on, we will improve treatment response. Patients will be healthy, and there will be less need for expensive biologics. But if we want to improve adherence to methotrexate early, we firstly need to know how many patients adhere to methotrexate early on. What are the reasons they do not adhere? And we also need to know, can we identify which patients are less likely to adhere before they begin treatment? To do this, we recruited patients from across the UK and collected clinical, psychological and demographic information. And then we followed them up over 6 months and we asked them to complete a diary about their methotrexate use. Now there is no perfect measure of adherence, but the benefits of a diary are that you can ask a patient if they missed a dose as it happens and the reasons why. So, what have we found out so far? To date, we've collected information on 600 patient diaries, and we found that adherence is actually higher than we expected. Only 26% of patients did not adhere to methotrexate during the first 6 months. And when we looked at the reasons why, we found it was concerns, either about side effects from the methotrexate, or they thought that methotrexate was lowering their immunity to stop them fighting other illnesses. And when we looked at all the information patients gave us before they began treatment, we found patients who had high concerns about their rheumatoid arthritis were less likely to adhere. So that tells us that overall adherence is good, but that patient concerns both predict non-adherence to methotrexate and are the reason for non-adherence to methotrexate. Therefore, if we can change the way consultations are done to lower patient concerns, we may be able to help patients adhere better and improve treatment response. Thank you very much.